Hello everyone, this is Sanjeev Goyal. I'm president of IIT Delhi Excellence Foundation. And today I really want to talk about a very, very important issue. I don't know if all of you know, there are more than 1 million people every single year go through amputation due to late diagnosis of diabetes. So I have invited two very amazing guests to talk about it and discuss how can we solve this problem with science. So before I go a little deeper, I wanted to share some data, and I may or may not be accurate. One is that diabetes is 7th leading cause of death in the world. Approximately 463 million adults living with this disease. 1 in 8 adults have diabetes. I'll talk about a small story, what really transpired this for me to take such a major action and move a lot of people and my whole group for this cause. All of you know I invest in startups. So somebody pitched me that he wants to open 100 hospitals in India and tier 2 cities. So it's interesting. And he said, it's an amazing business, there are a lot of opportunities, a lot of work we can do. And I said, that's fine, but 100 hospitals, I still was curious. Then he said, the model is very simple. There is a lot of need for amputation. And I was curious, what do you mean by amputation? He says, a lot of patients comes, and by the time they reach cities, the diabetes is already aggravated, and now the only cure they have is cut their foot. And I'm thinking in my head, it's like, okay, maybe 10 people, 20 people, 100 people, why do you need 100 hospitals? He says close to 400,000 people need such surgery every single year. Now, to give a perspective to you and our audiences, in COVID, in India, 500,000 people died. We are talking about 400,000 people losing their livelihood every single year, even if they are survived. And of course, a lot of them dies. Some go through dialysis, some have heart attack and other disease. And so that's why I invited pretty amazing panel. So we have Dr. Eric with us. Dr. Eric is a ER doctor. He is expert of public health and he practices in Brooklyn. So Dr. Eric, why don't you talk a little bit about and share with our audience, what is the size and why something like this, which should have been cured 50, 60 years ago. We know insulin, we are giving insulin shots for God knows, I don't know how many years. Yeah. It's not cured yet.
No, and thank you.
And it still goes undiagnosed.
Yeah, thank you so much for having me. I think that part of the issue with diabetes and diabetes management is, like everything we're talking about in healthcare at WEF, it's about access to care, and it's all about access to quality care. And both of those things are challenges for the majority of the world still. And, you said diabetes is the 7th leading cause. Diabetes is also a major contributor to stroke and heart attack, which are higher than number 7 on that list. And so when you think about the aggregate amount of burden of disease in the global burden of disease that diabetes has a part of, it's tremendous, it's overwhelming, it's staggering is the only way to describe it. And the idea that some of this, this isn't something like COVID, where you get sick and within 3 weeks, you're on a ventilator or dead. This is something that, we have opportunity after opportunity to detect, to prevent, and to treat. And so what ends up happening is when people don't have access to care, the end result is, their foot gets a blood supply diminished and then cut off, and they need an amputation. That is the tip of the iceberg, and that is a huge failure of public health. There's an upstream kind of detection that's years earlier than amputation of foot. And it really involves a very simple blood test. At times it can be done as a point of care, finger stick. that will detect.
So we'll come to that later on the detection. Next, I have Bryan. Bryan, an expert of AI, and he understands computer vision extremely well. And his current company is almost unicorn. So Bryan, what do you think should be done with technology to solve a problem like that? Because you and me are engineers. I believe we can engineer pretty much anything in our life. So why can't we engineer diabetes?
Yeah, that's a very good question. First of all, thank you so much for having me here. Look, as many of you guys probably already know, and you know, artificial intelligence is having a massive impact on every single industry and every company. I think the best analog to look at is if you remember the 90s when the internet, Web 1, was coming out. The companies and the industries that embraced this new technology had a massive competitive advantage in the space and were able to solve some very real problems. And in that same way right now with artificial intelligence, we're able to have a massive impact in every industry and every use case across the board. And medicine is no different.
Sure.
Look, by collecting a significant amount of data, we will be able to feed that through artificial intelligence to be able to provide everything from new pharmaceuticals, new therapies, but also being able to understand the diseases, being able to figure out the prognoses much better, but also with that early detection, which is so critical when you're thinking about diabetes and amputations, or being able to deal with a lot of these challenges before they get to such severe remedies.
So this is fascinating, and I have a lot of questions for both of you. So let's start with a simpler question. So Dr. Eric, how complicated is diabetic test, and why it is not accessible to the remotest places? Is it really that complicated?
No, it's not really complicated. Like everything in healthcare, it comes down to money.
Okay.
The best test, which is hemoglobin A1C, which if you think about your blood sugar as something that fluctuates minute to minute, day to day, a hemoglobin A1C is your average blood sugar, right? It's a way of measuring, over a course of the day, how much is your blood sugar spiking, and it's an early sign of insulin resistance. We do this yearly in the United States as a part of an annual physical, and so this really. This is about access to good quality primary care.
Yeah, but earlier we were talking and you said in Brooklyn, even if you do every year in a country, developed country like America, you have patients coming with late stage diabetes, and you have to still refer them, or they go through amputation, and you have seen thousands of such patients personally.
Yeah, it's actually it's absolutely all true. And I also see patients with strokes, heart attacks, something called diabetic ketoacidosis, which is a life-threatening surge in your blood sugar that causes a starvation state. We see that in the ER a lot. That's not a failure of the detection. It's not a failure of the test. It's a failure of the human beings in our primary care systems. And so even in the mecca of US healthcare in New York City, we have very different determinants of health, and where you live in New York City, what your zip code in, can alter your life expectancy by up to 10 years.
So you mean to say it's all about income level now, or what are we talking
it's
here?
not.
Because Brooklyn is like it's in New York. It's
it's
it's the most I would say the connected part of America.
It's not just
we are not talking
income.
about Arkansas. We are not talking about a small town outside Modesto.
Yeah, no, it's about population density. It's about how many primary care providers there are. It's about socioeconomic. It's about access to health insurance. It's about the color of your skin. It's about a lot of things. It's multiple. The social determinants of health are enormous, and we probably could take an entire other panel discussion to talk about them. But the lack of access to that test, interpreting that test by a physician or a physician assistant or an NP, and then prescribing medication or altering your lifestyle, that all needs to happen in order to avoid that end result of getting a foot amputation.
Oh. So I'm to be honest, I'm kind of lost, and I can really use some guidance from expert like you. And Bryan, we are I'll use not a great example. In India, people look at your face and they can tell you their future. Why can't we do that today with medical science? People like you who are so smart and understand computer vision or technology like RPPG, where with the light source you can detect the color, and with the color of the skin and how it reflects. There are so many things you can do, I was told, like blood pressure, heart rate variability, even breathing rate I heard is possible, oxygen saturation, and people are even talking about hemoglobin. Why can't we detect diabetes? Is it the problem of the technology, or is the problem of the data?
I think it's the problem with the data. Look, the technology's been around for a very long time. If you look at artificial intelligence, even most of the algorithms have been around for decades.
Right.
And a lot of the technology for computer vision to capture the data is there, but the data we have to have enough of the data, and we have to analyze it across the artificial intelligence. Let me give you an analogy in another field within medicine. So I was just talking to my friend Richard, and he was telling me about his friend who went in for a test. They did a full body scan. The doctor that looked at the full body scan said, everything's great.
It's fine.
Everything's fine. Now, they fortunately sent that full body scan to another company that applied artificial intelligence to it. Within a couple of days, that AI was able to determine that they had a very aggressive form of cancer.
Wow.
And if they had not caught that cancer within a month or several months,
Early stage, they were able to detect.
Wow. And yeah, because they were able to spend that extra money and get that AI to look at the data, they were able to determine it, solve the problem, and the person's really healthy. And so in the same light, for something like diabetes, if you take that data that already exists, and if you train the AI models on sufficient data to be able to have early detection in a way where you don't have to pull out a ton of blood or be super invasive, that could massively impact the healthcare industry, specifically in diabetes, to allow us to be able to understand what's going on and be able to have those interventions much earlier before someone has to have their foot chopped off.
So if I can summarize what I understood, and based on my team's research, we found there are three things, which is the challenge. Number one is access to testing and frequent testing, which is once a year. Number two is medication, or probably the cost and how it needs to be funded and all. And number third problem is really awareness. People don't know about it, so education. Now, a bolt on to that is by the time the patient comes to you, you don't have a choice except to do education. And which is the last thing any doctor would like to do, but he doesn't have a choice, and they have to go through this like a very difficult decision. And we know the cost to the society is phenomenal when we attempt or we do anything like that, even if the person is going through dialysis for their whole life in some cases. So question for you is, how can we make this testing affordable? What needs to be done? And we are talking about a global problem now. We are not talking about America. What do you think?
I think with the increase in technology, the boom that's happening right now, I was at another panel with the WHO where I heard someone talking about we're going to be able to map the entire human genome for $1.
Mm-hmm.
So the testing is available, the technology is available. We need to be motivated sufficiently to get it down to the price point that makes sense, that actually will work. And then more importantly, we need the ministers of health of countries and ministers of finance of countries to talk about this and realize that it's much cheaper to check everyone's blood sugar or hemoglobin A1C than it is to pay for their dialysis or to pay for prosthetics after their foot's been amputated. It's orders of magnitude less expensive. And it doesn't even take into effect not just the direct care cost, but the benefit that person who now gets to keep their foot will have to the economy of that health, that country. And so this is an economic incentive. The problem is that there's multiple parties. And so when we say like, oh, for every $1 you spend on prevention, you gain $4 for your GDP. Well, who gets that money and who's benefiting from it? Because you need a beneficiary in order to motivate companies and people to do this.
So, I'm a big fan of data, and we are all technically engineers, three of us. And that's why we want to engineer the solution of this problem. And I want to leave this panel with that understanding that there is something possible. We can do something about it. So I talked to CEO of IMHE, and he coined a term, global burden of disease, at WHO, and he has done a lot of work there. In fact, Bill Gates Foundation gave him almost $1 billion to put together this data set, and I saw they get terabytes of data every day. So point I'm making is there is tons of data available, but it seems like it is in silos. Maybe both of you have better understanding. Where is this data coming from, and where is this data stored, and why can't we use it and develop multiple startups to solve not only diabetes, we can solve several other problems?
That's a fantastic question. Look, data is like gold, right? Data is our generation's version of
But it's
oil.
everywhere.
It is everywhere. Now, there are a couple challenges here. Number one, in the United States, we have extremely robust regulations around data and HIPAA and so forth. And so you have to understand HIPAA was written before the internet.
Mm-hmm.
And so it didn't take into account all the technologies we have right now. So it needs to be updated. The way we look at data, especially in healthcare, needs to be updated. And unfortunately, a lot of our regulators and a lot of our politicians are not as, let's call it, fluent with new emerging technology as they should be. And so a part of that is, how do we engage as technologists and engineers with our politicians and our government so that we're able to provide a new solution? That's number one. Number two, you're right, there's a lot of data, but most of that data is unstructured. So one of the challenges with artificial intelligence is having the right structured data and analyzing it properly. And so there has to be an incentive to do so. There has to be the correct pipeline for data flows to be able to take that data and turn it into something usable in the right time frame.
Yeah, and I think just to add on that, I think the other thing is that we, even though we try to break down silos, we still have significant silos. The WHO Global Compact on Diabetes, which had its first year last year, is really trying to address all of these issues. But the problem is that we, the governmental actors and the non-governmental organizations and the private industry just have these still gigantic walls between them. And so a lot of the impatience and the ingenuity that we see in the private sector doesn't get pushed into these multilateral or governmental organizations, or even the NGOs, because it's just a different pace. And I like the level. There's a very low level of frustration tolerance in business. You want to fix a problem, whatever the problem is. And unfortunately, in the nonprofit world, we spend a lot of time admiring problems.
Wow. I had a similar kind of conversation in the morning with the Pfizer CEO, and it's fascinating. We all know the solution, it seems like, but it's just the sheer desire to collaborate is missing. And that's I come from a startup world, and that's annoying.
Yeah.
But it's a problem, and it's an opportunity too for all of us. So that brings to almost end of our segment. So any parting thoughts for our audience? I will start with Eric first.
All right. I think that, this is one of those problems that's not as complicated as some of the other public health problems. I mean, this is...
we are talking about a million people losing their leg, a foot, man.
No, I agree. But this is something this is not a moonshot. This is like orbit the Earth. This is pretty close to fixable. We
can do at least, we can say 99%.
Yeah, we need the political will. We need the government payers. We need the venture capital and companies to understand that the runway on healthcare innovation is a little bit longer. You can't exit early. You have to kind of stick with it for a little bit longer. But the payoff and the benefit can be so much better, not just for society, but for the companies that are developing this technology and these innovations. And so I think that I'm very excited, having been to this conference now, to see all of the people looking into the healthcare space and trying to innovate, because we haven't seen in healthcare the same steep slope of innovation that we've seen in other places, in other industries, and that's partly because we're the most regulated industry in the world.
Absolutely, and I definitely agree with that. And look, most problems have a multifaceted solution, right? So a portion of it is figuring out when people have an issue, being able to diagnose it and provide the solution. Part of it's also education, right? Educating the population on how to live a much healthier lifestyle, how to eat properly. And unfortunately, we lack that in the country. And I think using artificial intelligence in areas like education to not only teach people how to code or get the skill sets necessary to get a job, but also how to live most effectively so that they can have the outcomes in their lives that are going to benefit them with life expectancy, health, and so forth. And this comes back to SDG number 17, which is public-private partnerships. We have to engage between NGOs, as you mentioned, governmental organizations, and startups to all be able to work closely together. And that's part of the reason we're all here at the World Economic Forum in Davos. And there are ways to push that forward. I think that if we look at countries like China, they obviously have some negative things. There's some disagreements around the way that we engage with the world and the way we engage with data. One of the things they do extremely well is that partnership. They set long-term goals and work collaboratively together across different areas of their society to make sure they get to those solutions. Now, we have different ideas around, top-down versus bottom-up and so forth, but there's an opportunity in the Western world, and I include India in that.
Yeah, we are so connected.
Sure.
So Bryan, thinking India as in isolation or
Sure.
China as an isolation is not possible. And COVID has taught us these boundaries are man-made.
Yeah, absolutely.
So when something is spread, like COVID, when diabetes, all of these things, we are all same, and it is going to impact everything. So if we can come up with a solution, which I'm sure we can, and I'm really proud of my education system. It has taught us one thing, that if you are really passionate about it, you can engineer a solution.
Absolutely.
And it's an engineering problem. It's not just a medicine problem. We have to find ways. How can we work collaboratively? How can we create better infrastructure? How can we build research facilities so we can develop these new ways of testing? So here is my dream, and that's what I would like to share with you and our audiences. My dream is we made this testing almost to the 5 to 10 cents. We make it mandatory, every single citizen to take this test once a year. Because just by doing that, we will be able to save 1 million people, their livelihood, their pride, and huge burden on the society. Because now this person may become dependent on the society. And that's the last thing we are looking for. And the biggest, think about his family. Think about his kids, his wife, his brothers, sisters. Who is going to manage? How are they going to do it? So it's so important for me personally. I can't tell you, and I will love to stay engaged with you guys. Thank you very much for coming to our show today. And please do share if you find any research material or anything interesting for our audience. For our audience, this problem is huge. We are in 2050, we are going to be almost 10 billion. So we are going to have more people. We are eating more processed food. We are not eating quality food. So probably we'll have more diabetes. So if you can figure out an inexpensive way to test it, I believe rest of the problem will be taken care of by pharma companies. I'm not a big fan of large pharma companies, but we need them too. They have done a phenomenal work, and I believe they will continue to do it. Based on my conversation today and understanding with the Pfizer CEO, it is an exciting time, and pharma companies are open to collaborate with government and everybody else. Once again, thank you so much.
Thank you.
Thank you for having us.
Pleasure to have
Thank
you.
you. Thank you.